Hi, I'm Dr. Tibbo Carrigan, orthopaedic surgeon who specialises in foot and ankle surgery and limb reconstruction. And today I want to talk about midfoot arthritis. What's the midfoot? The midfoot is the part in the middle between the forefoot and the hindfoot. The hindfoot is the ankle and the heel. The forefoot is the toes and the bones that are connected to the toes called the metatarsals. And in that space in between, this is an area called the midfoot. And it's made up of a bunch of bones that are all connected together, and they form an arch in two directions. So there's an arch across this way, but there's also an arch this way. And the key to that arch is the second metatarsal here, which fits into these bones called the cuneiforms, and there's three of them. And then there's the cuboid bone over here, which forms joints with the fourth and fifth. So you've got 5 toes, 5 MTP joints or knuckles, and then 5 metatarsals. And then these bones are called the tarsus. So these joints here are called the tarso-metatarsal joints. Now, the midfoot doesn't move very much. The ankle moves a lot, the toes move a lot, but the midfoot does move, but it's more flexes, adjusts, doesn't have huge amounts of movement. But you can develop arthritis in these joints, and even though there's not very much movement, it can develop into a very painful condition, and that's called midfoot arthritis. And typically it affects the second and third tarsometatarsal joints and the medial cuneiform, naviculo-cuneiform joint. But it can at times go right across the midfoot and affect all of these tarsometatarsal joints. And it can be associated with significant deformity in the midfoot as well. And that's where you can develop a collapse of the arch as part of a flat foot deformity. And sometimes the foot can head off to the side. And so it can be a very complex combination of deformities. But the arthritis causes pain with walking, and extra bone can develop at the edges. They're called osteophytes, and they can form big bumps across the midfoot. Now, what's the treatment for this? So the non-operative management is supportive footwear. Sometimes targeted steroid injections can help give patients symptomatic relief. And modifying your footwear, orthotic support, all of these things can help. With patients, it can reach a point where that's no longer effective and they need to have surgical intervention to try to relieve pain, correct deformity. The principle for these joints is we don't have a replacement for the midfoot, a joint replacement. The way to treat the arthritis is to fuse those arthritic joints. So that's where we get the two bones joined together. That eliminates movement and relieves pain. And in that process, we obviously take away any of the extra bone, the osteophytes, and we realign the foot. When you do that surgery, it can involve 1 or sometimes 2 incisions on the top of the foot. We need to be very careful about the skin, which is often thin, and the soft tissue coverage over the middle of the foot is not as thick as other areas of the foot and ankle. So wound problems can be an issue. And nerves. So there's nerves that cross across here called the subficioperoneal nerve, and there's another nerve very closely related to the second metatarsal called the deep peroneal nerve. So we have to protect these nerves, gain access to the joints, and we remove the arthritic surfaces. We put bone graft in there. The best bone is your bone. My preferred location to get that is from the top of the shin bone. Sometimes we have to get it from the top of the pelvis. And we put bone graft in there and then we plate it. And there are special plates designed for this type of surgery that helps hold the position and hold it still to allow those bones to join together. Now, you're talking about small bones with short distances but big forces. So when you're fully weight bearing, the midfoot's caught between your forefoot and your hindfoot with more than 10 times body weight going through there at times. So when you have a midfoot fusion, you can't put any weight on it for 6 weeks, and you're in a boot for a total of 3 months. And this is to give the body an opportunity to heal and to get stability enough before we start putting full weight through it. So the main things we worry about with midfoot fusion surgery is wound healing, nerve problems, and failure to unite cord and non-union. But successful surgery, which we do achieve, fortunately, in the vast majority of cases, we can correct deformity, we can relieve pain, and that makes a huge difference to the quality of life of patients with midfoot arthritis.